Assalamu alaikum class. Today I am going to deliver lecture number 5 of epidemiology, which is the continuation of my last lecture. In my last lecture, I have started discussing with you descriptive studies, and in descriptive studies, you already know that we have discussed the cross-sectional surveys and longitudinal studies. Going through the learning outcomes, we have already discussed study designs which come under the heading of descriptive epidemiology. We have gone through the steps of conduction. We have already discussed the person distribution and place distribution of disease and advantages and disadvantages of conducting cross-sectional surveys and longitudinal survey. The only thing which is left behind is the time distribution, which is an important component of the descriptive studies. So today, in today's lecture, we will be only focusing on the time distribution. We have already gone through the place distribution, which is studied under the cross-section surveys, and in which we have discussed multiple type of variations which occur in different places. We have gone through the person distribution and different factors which affect the pattern of disease in a person and how they affect towards the disease etiology. So today we are going to discuss the time distribution. According to time, diseases are divided into three further categories: short-term fluctuations, periodic fluctuations, and long-term fluctuations. As you can see, as the name is suggestive, the short-time fluctuation means the disease has a very short incubation period. It comes and affects the community and goes away. So there is a very short span of these diseases. Then the second component is the periodic fluctuations. These are those diseases which repeat themselves after a certain period of time. This period of time may be in months, maybe in hours, maybe in years, or maybe after 10 years or decades. So the diseases which repeat themselves after a certain period of time are shown by the periodic fluctuation. Then we have another type of presentation of disease according to the time, which is known as long-term fluctuations. And long-term fluctuation means that these periods show different, these diseases show different trends over a longer period of time. These diseases are exactly opposite to the short-term fluctuations, in which the disease comes, affects the community and goes away. But in long-term fluctuation, the diseases remain in the community for a longer period of time, and they show different trends over a longer period of time. So we will be discussing all these types of fluctuations one by one. As you can see, in time distribution, the time is shown on the x-axis and the number of cases is shown on the y-axis, and it is presented in the graphical presentation. It shows where the number of cases were maximum. It shows where the number of cases were minimum, and they were not present. So the time distribution shows the relationship of the presence of number of cases according to the time trends. So short-term fluctuations, as I have already mentioned, they come, affect the community and go. So they are known as epidemics. They are labeled by the epidemiologists as epidemics. They are defined as the occurrence of a disease in a community or in a specific region, clearly in excess of the normal expectancy. It means that a disease, if it is present in the community at a certain rate, it means the disease is endemic. But if there is an excess in the number of cases, then which was expected normal by the epidemiologist, the disease is now labeled as epidemic. So there are different diseases which present with different epidemic trends. For example, the dengue hemorrhagic fever has shown different types of trends in 2012, in 2013, and in 2014. You can see, according to the time distribution in months, that the number of cases which were maximum were reported in August in all the three years. So we can say that there is a relationship of dengue hemorrhagic fever with this time period of the year. So in epidemic trends, what do you understand? What is important to understand is that the relationship of the number of cases is made on the basis of the time to which it presents itself. Fine. Moving forward, the types of epidemics, as you can see that the total number of cases in the community were almost at a certain point in time, they were showing a similar pattern. But in July and August, we expect the number of cases will be higher than the normal expected time, normal expected frequency. So in July and August, we will label it as an epidemic of dengue hemorrhagic fever, in which the number of cases are more than the expected. So the epidemics are further divided into three subtypes: common source epidemic, propagated epidemic, and slow epidemic. As the name is suggestive, if the epidemic is caused by the exposure to a common source, then it is known as common source epidemic. If the epidemic pattern is propagated from person to person transmission, or it is propagated by vector bite or insect bite, then the human to human transmission, where a large number of people are affected, it is known as propagated epidemic. And slow epidemic means that the number of disease is increasing, but it is continuously increasing over a period of time with a slower trend. So moving forward, common source epidemic are further subdivided into two types. The common source epidemic, as the name is suggestive, there is common source, but this common source can be due to single exposure, or it can be due to the continuous or multiple exposure. So if it is single exposure, then it is known as single exposure common source epidemic, or the other name is known as point source epidemic. If the exposure is continuous, it is known as continuous common source epidemic or multiple source epidemic. The other type is the propagated epidemic, and then it is further subdivided into two categories. Number one, if there is person to person transmission, and number two, if there is involvement of arthropod, or if there is involvement of any animal reservoir. And then there are slow epidemics. So moving with these concepts one by one, you can see that this is a normal community with normal people. No disease has affected this community. And once a disease affects the community, then the number of cases appear in this community, as you can see it with the presentation of a different color. Dark blue color represents the number of diseased population, and light blue color shows the number of cases which are susceptible but they are not diseased. So we can separate the diseased population from the non-diseased population. If we have categorized the diseased population from the non-diseased population, now we are interested in only the presentation of diseased population according to time. So these will vary from each other according to their age. They will vary from each other depending upon their gender distribution, and they will vary from each other according to the time of onset of disease. So different colors coding shows different times of appearance of the disease pattern in these particular patients. So if I want to draw an epidemic curve, I will draw the time in days on the x-axis. As you can see, these are the number of days, and these are the number of cases on the y-axis. So now, according to the dependence of the presence of the number of cases per day, I am going to draw the epidemic curve. Look at this, this is the population and this is the color coding. For example, the green color case has appeared on the day 1. Yellow color cases have appeared on day 2. And then the other cases of the dark yellow color with green head are appearing on 3rd day. So as a clinician, I can assign them the days of the appearance of the sign and symptoms, and I can put them according to the distribution of cases according to the days of presentation. Fine. So I will get an epidemic curve. All the cases have been distributed according to the time distribution. Now you can see that the peak was observed on the second day. The first case was presented on the day 1. The last case was presented on the day 5. So you can very well imagine it's a point source epidemic because it has shown a shorter time period in which the number of cases appear on day 1, they reached at maximum at day 2, and then they start declining, and on day 5 the disease was absent from the community. This is the total time period from 1 to 5 days. So an epidemic curve is a graphical presentation of the number of cases by the date of illness onset. Fine. So the number of cases are presented according to the time distribution in epidemic curve. The overall shape of the epidemic curve can tell us about the type of the outbreak or the type of the epidemic. So we have now common source epidemics. The common source epidemic means the number of cases are appearing because of the exposure to a single case. According to the exposure to a single source. Fine. So there is a common source epidemic that the number of cases are originating and they have been exposed to a common source. It can further be subdivided into point source and propagated epidemics. So look at this, that how the disease presents itself in the community. What kind of curve it is? It shows that the number of cases have started on day 1. On day 10, the number of cases have finished. On day 5 and day 6, maximum number of cases appeared. And then on day 7th and 8th, the cases started declining. So on the basis of examination of epidemic curve, we can assess that this is a point source epidemic or a single exposure epidemic. In point source epidemic, there is a sharp increase in cases. As you can see, there is a sharp increase in cases. The cases reaches at the maximum and then they start declining, and within a short period of time they decline and there is no more case in the community. The example of the point source epidemic can be exposure to the contaminated food. For example, if there are few people who are residing in a hostel and they have eaten a contaminated food in the hostel, the epidemic will start soon after the consumption of the food, and then it will increase with the presentation of cases, and they will reach maximum into 4 and 5 days. And after that, the cases will start declining as there was a single source of exposure and single exposure was done, and now the cases are now declining because the exposure is not there. So a point source epidemic has a curve, has a rise fall, and it increases in time, it falls rapidly, there is no secondary wave, it is explosive in nature, and within the same one incubation period the disease goes away. So examples, as I have already mentioned, food poisoning. Another example is leukemia in Hiroshima, which occurred after the atomic bomb explosion, which affected a large number of people, and they presented with leukemia. And once the exposure was removed and there was no further radiation exposure, the number of cases of leukemia were declined there. Another example can be, which can be given, is the Bhopal gas tragedy, in which the Bhopal in India, a sudden explosion was occurred in an industry, and there was release of poisonous gas, and a large number of population was affected. And as soon as the exposure was removed, the number of cases started declining. So these are the examples of the point source epidemic. Let's see another type of epidemic. As you can see that in this epidemic, the number of cases has started increasing from day 1. They have reached maximum at the day 4, and then there was continuously increase and decrease in the population over a longer period of time. Fine. So it means there is a continuous exposure of something which is not helping the cases to decline in number. It means there is some source of exposure which is continuously increasing the number of cases and maintaining a large number of cases in that area. So this is known as continuous common source. There is a common source and there is a continuous exposure of gases. The example can be given as the cholera epidemic, which has affected and in which the John Snow estimated that the number of cases is continuously increasing because they were taking water supply from the same source. So if a contaminated water supply is there in the community, the number of cases will remain there because there is a continuous exposure until and unless we will change the source of the water. Another example can be that, for example, if the government brings in some vaccine and this vaccine is contaminated, as long as the vaccine is being introduced into the population, it will produce disease until and unless it goes away. So in continuous common source epidemic, there is a common source, but there is continuous exposure, which does not lead in the reduction of the number of cases, and continuously the number of cases present themselves in different waves. So in continuous common source epidemic, there is a sharp rise, but then there is a plateau formation because the cases are not declining, and this can be extended over days, weeks, etc. And the example can be a contaminated source of water. It can be infected commercial sex worker. Whoever is being catered by that commercial sex worker will get infection, and continuously the exposure will result in a number of cases in the community. And I have already given you the examples of the outdated or contaminated vaccines. Look at another type of epidemic curve. Now, this curve shows that there is a rise and fall. And then again, the number of cases are increasing and then they are decreasing. And then they are again increasing and then decreasing. It means the pattern of disease is presenting itself in the form of waves. And these waves are generated if we are dealing with propagated epidemic. It means the human to human transmission is there. So propagated pattern is seen in those cases where the human to human transmission is documented. And one of the famous example which we are facing nowadays is the example of the coronavirus infection, in which the exposure of person with the infected person is leading towards the propagated pattern of disease transmission. It started from the Wuhan with the cluster of cases, and now it has become pandemic. Whoever comes in contact with the infected individual gets the infection and then transmit it to the other people. And WHO has estimated that the rate of transmission of infection of coronavirus is 2.2, that every one infected individual can infect double the number of uninfected people in the community. So it presents itself with different waves. For example, if in this case, if the number of cases are have increased and now they are decreasing, again there will be a exposure to the susceptible population, and then again we will suspect a large number of cases. And once these cases are being settled down and we are going towards the decline of the number of cases, again there will be transmission from human to human, and again there will be another wave which shows the propagated pattern. The propagated pattern is basically affected by the number of the infected individuals, number of susceptible individuals. It depends upon the attack rate. it depends upon the secondary attack rate, and it also depends upon the herd immunity which is present in the community. So the examples of propagated epidemic can be the transmission of polio from one person to another person, hepatitis A transmission from one person to another person, and it is herd immunity dependent. And if the susceptible population is there, we expect again the high wave affecting the susceptible population from the infected population. So propagated epidemic can be seen in diseases which are transmitted from human to human. They can be seen in the cases where there are transmission to humans through a vehicle. It can be foodborne, it can be waterborne, it can be vector-borne. For example, if the dengue, in cases of dengue, the mosquito bite caused the propagated epidemic, where the mosquito sucked the blood of an infected individual and then it transmitted it to the other susceptible host. And the propagated epidemic can also be observed in case of the presence of the animal reservoirs as well. So just a recap, point source epidemic shows a rapid rise and a rapid fall, and the duration is actually reflecting the incubation time period of the disease. The continuous source epidemic, it starts with an increase, rapid increase in the number of cases, and then a plateau is maintained until and unless the common source or the continuous source is removed from the population. And then the propagated epidemic, which occurs in waves, and these waves are observed because of the transmission of disease from person to person. So by looking into epidemic curve, you can assess that which type of epidemic is presented and what is the type of the pattern, and then you expect that what should be the secondary attack rate and how it can spread. So basically the propagated epidemic occurs from humans to human, and it shows the generation time. Generation time means the maximum number of cases which occur between the two peaks, and the difference between the two peaks is calculated by the generation time. Sometimes we see the intermittent cases which are occurring haphazardly somewhere in the world or somewhere in the locality, which do not show any specific pattern. So we call them as the epidemic which is caused by the intermittent source, and there is no common source exposure or there is no propagated exposure. So we can calculate the incubation period while assessing the epidemic curve, and as you can see that this is the time of the exposure, and from the time of the exposure to the number of maximum cases which have reported, we can calculate the median incubation period in which the 50% of the cases have presented in the community. And this is the time period when the exposure, maximum exposure has occurred and the maximum number of cases have occurred. From the time of exposure up to the maximum number of cases, this time period is known as median incubation period. Fine. So the median incubation period from the date of the start to the minimum incubation period, and can also be calculated in which the single case has occurred. So this is the minimum incubation period. This is the exposure. This is the minimum incubation period when the first case appeared. And this is the maximum incubation period where the last cases have appeared. So we can calculate the probable exposure time and minimum incubation time, maximum incubation time, etc., etc. So moving towards now the second trend of the time distribution, which is periodic fluctuations. And as I have already mentioned, the diseases show their pattern repeatedly in different periods. It is further subdivided into seasonal trends and cyclical trends. Fine. In seasonal trends, we can see that there are certain diseases which increases in certain diseases. For example, you can see that there is always increase in number of cases of whooping cough after a certain period of time. So we always see a sharp rise after a certain period of time. So for example, the measles and varicella and cerebrospinal meningitis, they present themselves in winters. Measles presents itself in spring. Upper respiratory tract infection presents itself in winters. Diarrhea presents itself in summers. So there is seasonal fluctuation in number of cases which are presented, and this seasonal trend depends upon the temperature of the environment, it depends upon the humidity, it depends upon the rainfall, it depends upon overcrowding, it depends upon the life cycle of the vectors, and multiple factors affect the disease transmission in that particular season. So as you can see that measles and varicella present themselves in spring, upper respiratory tract infections are more common in winters, gastroenteritis is more common in summers, and there are multiple factors which can affect the seasonal trend of a disease in case of infectious diseases. But in non-infectious diseases as well, we can see seasonal trends. For example, snakebite is more common in rainy season, hay fever is more common in spring, sunstroke is more common in summers, frostbite is more common in winters. So it is commonly seen in both the infectious and non-infectious diseases. Again, just to show you the seasonal trends in pneumonias and influenzas, that it increases in winters. And then there are cyclical trends. Cyclical trends means that the disease repeats itself in cycles. For example, even if there is complete coverage of the community with immunization, the measles repeat itself after every 2 to 3 years. There is an epidemic of measles. Rubella repeats itself after every 6 to 9 years. Influenza repeats itself after 3 to 4 years. There is basically the reason is that the susceptible population increases as compared to the immunized population because of the change in the herd structure. And whenever there is herd structure change, the ratio of susceptible population to the immunized population is disturbed. It increases and the immunized population decreases, which shows that the disease pattern shows maximum strengths. So variation in herd immunity presents with the disease cyclical trends in which the disease appears in cycles, at different cycles intervals. There are certain diseases which show a pattern over a prolonged period of time, which is shown by the secular trends. As you can see, the deaths by the tetanus were very, very high in 1955, and then they started declining. And in a certain period of time in 2000 and in 2010, the number of deaths by the tetanus are almost negligible in developed countries. Again, another example, for example, the number of cases with the coronary heart disease were minimum, or they were less in early 80s. And then they start increasing, and at the end of the 1990s and 2000, the number of deaths because of the coronary heart disease are very high. So these diseases have shown their pattern over a period of decades, and they have shown increase or decrease over a prolonged period of time, over decades. This is known as secular change. So secular change actually presents a longer time period, the slow change in the trend of the presentation of the diseases. Time clustering can also introduce us towards the causal agents. For example, in early 1950s, it was seen that there was a sharp increase in birth defects. And then the epidemiologists discovered that why there is change in the time trends of these birth defects, and then they concluded that there is an exposure of thalidomide in early pregnancy, which prevents the early morning nausea in the pregnant female, and increased intake of thalidomide has caused birth defects. Then another example of time clustering was seen in case of toxic shock syndrome, when the tampons were introduced in the population, and the females who were using contaminated tampons, they suffered from toxic shock syndrome. So again, the epidemiologist concluded that why the females who are using tampons are showing toxic shock syndrome, and then the conclusion was drawn that it is because of the contamination with the Staphylococcus aureus. And another example of the investigation was the presentation of adenocarcinoma of vagina in young females, which were presented in early from 1950s to 1980s, and it was then concluded that that it is associated with another drug, diethylstilbestrol, which is used, which can result in the adenocarcinoma of the vagina of the babies whose mother have used diethylstilbestrol in the pregnancy. So time clustering gives us a clue towards the etiology. It helps us to understand the pattern of disease. It helps us to understand the transmission of disease. It helps us to plan the healthcare service provision for the community, and it also helps us to generate the hypothesis. So this comes to an end of the time distribution in cross-sectional surveys. And if you have any question, I'm open to it and I will answer your questions. Thank you so much. Please read this subject very carefully from PARC. Thank you so much.